Right now, what we're doing, rather than that face-to-face, we are talking to people on the phone, assessing their needs to see how we can help them during this period of time.
I want to talk a little bit about our seniors who are watching during the COVID-19 crisis. And joining me now is Ron Taylor. He is the CEO of the Detroit Area Agency on Aging. Hi, Ron. It's good to see you.
Hi, thanks, Christy. Thanks for having us.
And also with me is Sylvia Brown. She's the Chief Clinical Officer, and she's a nurse by training and oversees long-term care. Hi, Sylvia.
Hi, how are you?
I'm doing well. And I guess the big question to both of you, and I'm going to start with you, Ron, is how are you all doing and the numbers of seniors that you're taking care of right now? Ron, I'm going to start with you.
We're doing well. We have a pretty resilient group as related to responding to the issues that are before us. And I think it's the genesis is related to their compassion and their commitments to serving our community and serving our seniors. So we're doing well. We have seen things increase dramatically as related to our numbers. And if you would have asked me beforehand, Christy, if we could have handled such, I probably would bet or place my bet as related to know that we couldn't, but just based on the character of the individuals in which we work with and that we have in our network, there's a great resiliency and a great commitment to ensuring the safety and the services are delivered to our constituents.
You know, sometimes we don't know what we're capable of until we're stretched, until we're called in a crisis situation. Ron, give us a sense, though, of the numbers of seniors that you were helping before this, and if you can almost estimate what the numbers look like now.
Yeah, what I would say is that probably the greatest gauge would be within our nutrition program. And I will say that is because the continuum of services in which we offered previously has somewhat constricted based upon the social distancing and things of that nature. But within our nutrition program, prior to COVID-19, we probably served on average 3,000 meals per day, 2,000 in the home delivery meal program, and approximately 1,000 within our congregate setting. Since then, our numbers have jumped up to probably about 8,000 or 8,500 that of which we're serving as of today. So within a month's period of time, our capacity has expanded and we've grown a deal in that manner. Also, I would say, Christy, what we've seen a significant increase as related to the calls in which we're receiving on a daily basis. We're probably averaging about 250 to 300 calls daily, people seeking information or just seeking nutritional services or support with grocery shopping and other things.
Sylvia, we talk about seniors being susceptible to COVID-19, that they're among the higher risk elements of our population. Talk to me a little bit about what some seniors are talking to you about and how you're talking with families and working with them in this situation right now.
Right. So I'm responsible for the boots on the ground people. Prior to COVID-19, our people go in the home and they do face-to-face comprehensive assessments. But because of COVID-19, we're unable to do that now. So we handle everything by phone. We are the entity with downstream providers that do the hands-on work, but we are the people that put that in motion by doing that assessment. And what we're hearing from many of our participants, they are a little afraid of course, like we would be, of getting that disease. So now what they're doing is they're looking more to their family to help them out because most of us are working from home anyway now or not working. So they now can lean on their family more rather than letting the downstream provider caregiver go in the home to help them out. But right now what we're doing, rather than that face-to-face, again, we are talking to people on the phone, assessing their needs to see how we can help them during this period of time.
What are the biggest concerns? Are we talking about not being able to find services, a little bit of depression? What are some of the things that you're most concerned about?
Concerned about not being able to do what we normally do. I know this is an abnormal time, but we're still concerned about making sure that our seniors, as well as our disabled population, is still taken care of. We want them to remain in their home as healthy and safe as possible. And we have to now do that remotely. So that means that we have to reach out more, have more of an effort to contact them, if not daily, at least weekly. Whereas before, we would just call them once a month, depending on the need, or see them once every 2 or 3 months.
Ron, this is the turn on a dime that we were talking about, that you had to kind of refigure how the agency does its work in a matter of days, and then figuring out along the pathway as news has changed, as the need has changed. What are the biggest concerns for you and the new services that you feel that you're offering now for seniors?
Yeah, I would say the biggest concerns is probably multifaceted. I think we have our immediate concerns. What I would say as far as short term, it's related to as far as our capacity to continue to grow and to expand to provide the services. It's really been a great collective effort as related to the ability to meet the needs of our constituents at this particular point in time. But Christy, I also have the concern is related to as far as our return to the workforce. Also, as Sylvia alluded to, as far as some of our downstream partners and direct care workers and their safety, and also their ability to continue to deliver services within the home. And then also just reimagining what our work life, or what our work environment, or what our service delivery system will look like once we do return, what with the new normal versus the old normal. And so it's kind of like I see the utilization of technology and us doing things virtually really coming into play. And I think there's also going to be some things in regards to working with caregivers, and also integrating family more, and other institutions or community-based organizations into the process.
It sounds like it's a continual transition. And Sylvia, you talked a little bit about the telemedicine, a part of this, and being in touch in an entirely different way. So I understand there's going to be a grant to help with some research, that telehealth. Can you speak to that, Sylvia?
Right. So we're working on that right now, and Ron could probably fill you in better than I can. This is a new endeavor for us, and our goal is to work with some other partners to make sure that we keep our members safe, our participants safe, rather than them having to go out to a doctor's appointment. Now that can come in their home by way of technology, still to make sure that their healthcare needs are taken care of.
Ron, you want to pick up on, I guess, some of the looking for funding to be able to do things differently now and utilizing technology?
Yeah, we've been very fortunate as related to what we call as far as our Detroit Wayne Senior Telehealth Program. In regards to, we received $50,000 from the Michigan Health Endowment Fund to help serve as a springboard for us to get this up off the ground. But I would also say that we've been very fortunate as related to the civic and the community goodwill that have come forward to support our efforts and our initiatives. This community has really stepped forward to take care of their senior population, where there's been the financial means and or support through PPEs and or also volunteers.
Sylvia, as we kind of work through this every day in a changing situation, what keeps you up at night, and what do you kind of think about, all right, next week, this is what we need to tackle? What are some of your largest concerns as we move forward?
So every day, it's about the safety of everybody involved in this project. It's about our staff being safe, making sure that they are healthy and able to do the work that is required, making sure that we are touching base with all of our participants, not just the ones that are critical, but all of them, to make sure that they are safe. We are keeping a record of participants that have experienced this disease, and it's disheartening. The number is not a huge number, but one is too many. So we do whatever we can do to keep them as safe as possible. So that is what keeps us all up at night, is to make sure that our community is safe.
Ron, what about you?
I think, as Sylvia indicated, what keeps me up at night is we've taken the model is related to ensuring that we can serve our constituents, and then also making certain that our team members and their families are safe. And then also that we can serve as the tip of the spear, or the leaders for the agent network, to kind of provide the resources and or any guidance or information in which we could provide. The biggest thing in which I'm concerned about, in which each at me a time, is whether we're doing enough, whether we are reaching or touching that individual, or have we forgotten anyone, or or how can we continue to be able to do this for a long term without burning staff members out or running out of resources or things of that nature. So, but I would have to say at the same time, I'm energized based upon the fact every time I interact or communicate with our team members and or those that are within the network, just the energy and the can-do attitude and spirit that's demonstrated, it really lets me know that we're built to last. We're built to do this.
Sylvia, for a lot of us who have seniors in our lives who we can't go and see, that we've got to maintain distance, and we're trying to do the best we can to help care for them or check in on them. What would you say to people to remember about our senior population?
That they are loved. So at all costs, reach out to them minimally. Call them every day, if not 2 or 3 times a day, just to make sure they are okay. And what are their needs? Do they need some food, or what do they need? And try to find a way to provide whatever that is. Even if they have to call DAAA to see how we can help out, because we do have a lot of resources that we can recommend, and we can be very supportive for the community.
Mm-hmm. Ron, finally, what would you say to all of us, how we can help in any way, or what to keep in mind as you guys do a lot of the heavy lifting and the hard work?
Yeah, I would say it takes a village, and that we're all going to need to be connected to looking out for one another. And that if it could just be a telephone call, because social isolation is a concern, but just to make certain that you know your neighbor or your relative is doing okay, and also that we at the DAAA that we're fighting and we're doing everything in which we possibly can to be that senior solution and to provide the resources, but we also recognize that we cannot do it by ourselves. And so that there's a collective spirit as related to making certain that our population and our community is served in the best manner possible.
Well, Ron Taylor and Sylvia Brown, thank you so much for joining me. Thanks for doing the work and adjusting and keep moving forward and taking care of some of our most vulnerable members of our population, our loved ones. So thank you. It's good to see you, and be well.
Okay. And thank you so much, Christy. Thank you.
And you the same.
Yep.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.